Hello and welcome to Sounding Board, presented by Seroptimus International of Novato. Seroptimus is a coined phrase meaning better for women and girls. And tonight we have with us a very special guest who has dedicated her life and her career for the last 30 years to just that end. I'd like to present to you Stacy Bischoff of Whole Health Associates. Stacy is a women's health care nurse practitioner, and they are located in San Rafael, California. Stacy, welcome.
Thank you, Mary. It's wonderful to be here, and I appreciate the Seroptimist inviting me.
Well, good. We're happy to have you. Could you please tell us about yourself and your practice as a women's health care nurse practitioner?
Well, I'd love to, because it's the favorite thing that I get to do every day. I've been in practice for 30 years, and whether it's teens or women who are 80 years old, I get to see the range of them. My first job as a nurse practitioner was actually at Kaiser, and then I spent time in private practice, time in small clinics and large clinics. In the large practice, we had midwives, nurse practitioners, and physicians, and it was wonderful. I spent 10 years there. But in the last 15 years, I've become much more interested in a holistic approach. So I spent some time working in an integrative medical center. So that means that there were chiropractors, acupuncturists, different types of body workers, homeopathists, and MDs. And I saw that combining all of those modalities actually made people feel better faster.
Cool.
So 12 years ago, I created Whole Health Associates with a chiropractor and an acupuncturist. So it's very exciting.
Yeah.
Very, very exciting.
Sounds like it.
Yeah. I have fun. I have fun at work.
It sounds like it. That's great. We
Yeah.
should all have fun at work.
I know.
Good. So tell me, what is the youngest age teen that you usually see, and why do they come to you?
Well, I feel like teens are very special, and it's a privilege for me to get to see them. Most of their mothers are already clients of mine, and the youngest is usually 15 to 18. So some are young girls who their mothers feel that they need education about their bodies. They don't know much about menstruation, how to use a tampon. Sometimes that happens earlier. Also, STDs in this population are extremely prevalent. In fact, chlamydia is the primary STD these days.
What's an STD?
Sexually transmitted disease.
Okay,
thank you for it's the lingo, right? So when I see teens, probably 80 to 90% of what I do with them is educate them. I get out flip charts, I talk about ovaries and the uterus and how a menstrual cycle works, and educate them about their bodies. I've also been more concerned recently with the influence of teenage boys having what I would call a control over girls. And it concerns me. I think that we need to educate our teen boys a little bit more about sexuality and sensitivity. Most of the teens want birth control pills because they're easy. And a few teens more recently, there is a newer vaginal contraceptive. It acts just like a birth control pill, but you can put it in your vagina. It stays in for 3 weeks, and then you take it out, and then you have your menstrual period. So they do the same things, just in different ways. Part of what I do is to try to make girls feel comfortable about touching their bodies and communicating to their partners. If they use birth control pills, they still need to have the boy wear a condom. Condoms, condoms, condoms. And sometimes the boys don't carry them, the girls should start carrying them as well.
Exactly.
In their backpacks, you know, or their purses. So a lot of what I do with the teens and older women is listen and educate. It's very fun. And also I like to do this before they go off to college, because with the drinking that happens in college, sometimes young girls are taken advantage of, and if they've never had an exam or been educated, it's very frightening.
I'll bet.
It's very frightening,
Yeah.
Has that potential. Yeah,
Okay.
so they're a special group.
Good.
Yeah.
And you were mentioning to me too that there's, the boys now are asking the girls to do different sexual things with them?
There is a huge increase in oral sex that's happening, and the boys are actually asking the girls to shave their pubic hair, or they won't have oral sex with them. So there's a huge increase when I'm examining teens of seeing the genitalia being shaved. There's actually pubic hair there for a reason. It's designed to keep out bacteria. So I try to empower them to say no to the boys, unless maybe they want to have the boys shave themselves as well. And it's pretty gutsy of me to say, and they always laugh, but that's okay.
Yeah.
That's
exactly.
okay. Yeah, I like that.
You get your point across.
I really try to make my point home to them.
Yeah.
Yeah. I mean, being engaged in sexual activity is two people.
Right.
So if they can begin to have good communication with their partners at 15 or 16, it's not too young. That's my viewpoint about that.
Good.
Yeah.
Well,
Yeah.
thank you for that.
Yeah.
Good. Now, let's hit a little older population here. What causes PMS and irregular cycles, and how do you help women with these issues?
Well, PMS stands for premenopausal syndrome. And even though we're not talking about menopause here, it's really about the menstrual cycle. So menstrual cycle is about 28 to 30 days. The first part of it is estrogen dominant till you ovulate. The second part is progesterone dominated. So PMS are things like sore, tender breast, mood irritability, oftentimes fatigue, sometimes food cravings. So for a large majority of women, that's happening somewhere between 3 and 10 days before the next menstrual period. So what do we do about that? Well, sometimes I might mention changing diet, get rid of the sugar, get rid of the caffeine, possibly. Maybe you need a nap or you need a walk, because those things help the oxygen flow better to the breast tissue, to the pelvis, and all of that's very helpful. And this goes on not just in the teens, but through the 40-year-olds and even getting into the 50-year-olds. So occasionally I will suggest a hormone test. If it's blood, that might mean measuring the progesterone around cycle day 21, which is about the peak of when progesterone is at its highest. The other option is that there's a great saliva test kit that women can take home. So in the convenience of their home, they actually would collect 11 specimens. So it actually measures both estradiol and progesterone throughout the menstrual cycle. What's very validating about that is they come back and they review the test with me, and that's like, well, that's when that happens, you know? That's when I'm really irritated, or my partner or husband tells me to take a nap. It's very validating. For some women, it's needing a little bit extra progesterone. It might be a supplement like DHEA to help support their energy. So there's quite a few things to do. For some women, they need to go out and exercise really to help that. A good multivitamin and mineral is helpful as well.
Great.
Yeah, there's a lot of research about PMS because it's been going on for a long time.
Yeah.
Yeah.
Good.
Yeah.
Well,
Yeah.
it sounds like you can pin it down, and that's the saving grace of the whole